This Sunday, October 6th, is World Cerebral Palsy Day. Now, cerebral palsy is a neuromuscular disorder that impacts about 1 in 345 children in our country each and every year. Joining us this morning to talk more about how this impacts families is pediatric rehabilitation medicine physician at UTHealth Houston, Dr. Simra Javaid. Good morning, Dr. Javaid.
Good morning.
How are you?
Good, how are you?
I'm wonderful. Thanks for being here to talk about this obviously very important topic. What do you think the average person needs to know about cerebral palsy?
Yeah, so cerebral palsy is a motor disorder. It's the most common motor disability in childhood. As you mentioned, about 1 in 400 children in the United States are affected. So it's, you can see many kids on the street, and more than likely 1 out of 4 are going to at least have a diagnosis of cerebral palsy. So it's something that is really near and dear to our hearts, and I really want to bring more awareness to it.
How early can it develop?
So cerebral palsy is typically due to a brain injury that can occur before birth, during birth, or up until the first 3 years of life. In those first, important developing years, the brain is more susceptible to injury.
So injury of any kind. I mean, this could be anything from a car wreck to falling from the bed. I mean, anything?
Yeah, it could be a stroke in utero. It could be a brain bleed. It could be loss of oxygen during traumatic birth. Also, just a traumatic hit to the head, as a toddler. It could also be an infection during pregnancy. So it is a wide variety of causes.
So what do the symptoms look like initially that would bring a family in to say, I mean, obviously maybe you'd go in the first time with the bump on the head, but then we need to watch what, if anything, happens. So what starts to happen?
Cerebral palsy is a wide spectrum of symptoms. Some children may have a developmental delay as far as reaching their milestones, so may not be reaching their milestones to crawl, to walk. But cerebral palsy is really encompassed by this increase in muscle tone, or what we call spasticity, and that is really what parents first notice, and that leads to motor delay in development. And so when parents are noticing that their child is having a developmental delay, an increase in muscle stiffness, and other symptoms such as speech delay, hearing impairment, scoliosis, hip dislocations, there's a wide variety of things that this tone can lead to. So parents are often reaching out to their pediatrician first, and then hopefully getting in to see us to get that diagnosis.
And then I imagine that there's a wide range of treatments, or what do you do? How do you help?
Yeah, initially the first and foremost, the most important thing is diagnosis. So recognizing that this child was at risk for cerebral palsy, and then putting a clinical diagnosis together based on their history, their exam, and then incorporating early intervention. So whether it's physical, occupational, speech therapies, understanding what sort of delays they have. Again, if there's some speech delay, if there is some cognitive impairment, if there is a delay in walking, getting those early interventions are really important, but also managing that spasticity. So we incorporate medications, whether it's oral or injections. There's also some surgeries, including like an implantable pump that helps manage tone, as well as surgery that some of our neurosurgeons do called selective dorsal rhizotomy. So our treatments are tailored specifically to each patient.
And what are the outcomes typically, or is there a typical outcome?
There isn't a typical outcome. It really depends on how early the patient gets in, and how consistent family is with the recommended treatments, but early intervention has been shown to have better outcomes versus a child who got no intervention at all.
So it's not the kind of thing that you leave untreated.
Yeah.
But it sounds like the symptoms are pretty clear, that as a parent, it's not something that would sneak by you.
Yeah,
I mean, you'd have to really not be paying attention or something, right?
It should trigger in your mind, maybe my baby was born premature and was in the NICU. Maybe there was a brain bleed or a stroke that the doctors mentioned while the patient was in the NICU, and now they're having these delays. So it should really trigger a conversation with your pediatrician initially, and then kind of getting plugged into the right specialist.
I hope that helps some families out there. Dr. Javaid, thanks for being here today.
Thank you so much for having me.